Piotr, you talk about endocrine response during the first year of life, and you show a study where infants get different protein intakes from infant formulas, and surprisingly there are huge differences in the endocrine outcome. Which differences are there?
So I wouldn't say they are very surprising, because we really expected that the high protein intake may result with some changes in endocrine response. And based on earlier literature review, we expected IGF to respond the most to this protein intake.
IGF is what?
IGF is insulin-like growth factor 1, which has a similar action as insulin. So it promotes growth, but also promotes development. And there were association studies showing that IGF-1 can be related to later obesity risk or BMI increase. And we found in correlation with increasing branched-chain amino acids. So some of the amino acids increased to a very high level under high protein formula feeding, and this resulted also with the increase of IGF-1 levels. So it was a parallel and a very strict correlation between the amino acid increase and IGF-1 increase. And finally, of course, we found also these correlations of IGF-1 with some anthropometric parameters, like increase of BMI within 6 months, like weight to height correlation with insulin-like growth factor 1 at the age of 1 year. So based on this data, we can conclude that there is a strict correlation between high protein intake, levels of some amino acids, branched-chain amino acids, IGF-1 axis stimulation, and finally, this clinical outcomes, which is increase of BMI.
Is this a transient phenomenon, or can you, after 5-6 years, what happens there?
That's a very good question. Of course, we have clinical data for later outcomes. We measured our children at the age of 6 years, and this year Martina Weber published a study on behalf of our group, published a paper on behalf of our group showing that the risk of obesity increases 2.5 under high protein intake in infancy.
So this high IGF-1 and this stimulation of growth, protein synthesis, lipid deposition perhaps, has a long-term effect?
It looks like that. We also trace and follow different parameters, endocrine and biochemical markers at later ages, so we hope to report also data from later measurements. But at the moment we can strictly correlate these early events in infancy, including endocrine disturbances, with late health outcomes, and it seems to be a very clear metabolic programming process.
So early stimulation through protein, through high protein intake, indicates that there's later on a 2.5-fold risk of being obese as a child. This is dramatic.
Yeah, at the age of 6 years, and we follow these children now at the age of 11 years, so we believe we will find the same trend, because it seems to even increase with age.
Okay, let's see, and then let's rediscuss it. Thank you.
Thank you very much.